Hello everyone and welcome to another episode of Ask Dr. Bob. We have some tremendous questions today, some that nobody ever really asked before, and I really appreciate that. One of the very first ones is someone wanted to know about losing weight, and they asked a question about ketosis, which is fat burning. One of the reasons so many individuals have challenges losing weight when they eat carbs or grains and sometimes fruit is because when your insulin is up, your body really is not going to be burning fat, it's going to be storing fat. So the Dr. Atkins diet for some of you may be the answer. I really focus most of my life on vegetables, green, non-starchy vegetables and protein. If I do any type of grain, I usually focus on some rice with almond butter. But besides that, I primarily eat vegetables and protein. It's not a pure ketosis diet. You might want to do a little bit of research on it. But ketosis works by putting down the insulin level. Dr. Bob, I have PCOS, and this individual wanted to know a little bit more about it. PCOS, from my experience, is usually caused or precipitated by lack of iodine. The factor is bromine, fluorine, and chlorine take iodine out of the body. It's antagonistic to iodine. So if you're a swimmer, or of course if you use fluorinated water from your tap or take a shower without a shower dechlorinator, that is going to compromise iodine function. So we have helped many ladies minimize or eliminate cysts on their ovaries by supplementing with up to 12 milligrams of iodine every day. We use a product called Iodozyme. Probably the most scientific way to approach it would be to have a urine iodine loading test. If you happen to be someone that has PCOS and your healthcare provider suggested metformin, which is a pre-diabetic type of medication, I may have you consider looking into iodine supplementation. This is a very interesting question. Dr. Bob, are enemas important to us? I want you to know that I usually have a colonic at least 2 times a year, and the colonic gets into the deeper areas of your colon, your descending colon, your transverse, and your ascending colon. Usually enemas do the last 12 inches or so. I know we talk about coffee enemas in various books that I have written. I would much rather have you drink water and eat vegetables. That'll help your colon stay consistently clean or moving on a regular basis. I would avoid as much gluten as you can because that will cause your colon villi to stick together. Dr. Bob, I started using the castor oil pack for a fatty liver, and I've been passing gallstones. Well, this is what I'm sure was going on inside of your body. Your liver is probably starting to work and is probably releasing some sludge and some toxins. The castor oil works because it just helps that liver start functioning on its own. I also would suggest you may consider a wedge of lemon in the morning and a warm glass of water. Sip the water, eat the pulp of the lemon. That'll help stimulate liver function. Water's okay. And I mean, water is much better than necessarily doing an enema on a regular basis. And Dr. Bob, I have been using carrots. This is a question in reference to an optimal you, hashtag. What are the potential reasons for breakouts on different areas of the face? Well, your body uses your skin as a detoxifying organ. So carrots help promote liver function. So once your liver starts to function optimally, you're going to start to notice maybe some breakouts on your skin as your liver is just pushing all the toxins out. I do know that sometimes I see a lot of women have some bronzing on their left cheek and face, especially if they have liver compromise and sometimes even the adrenal. But for me to say to you specifically, are there patterns? I can tell you I see adult acne on the lower part of a woman's chin and their throat. But besides that, no specific pattern for skin challenges. Dr. Bob, I'm 83 years old and I can't drive my car anymore. You mentioned about blurred vision. You may want to be checked for macular degeneration. Macular degeneration usually responds well to cruciferous foods. I'm not going to tell you it's going to take it away, but you may want to be checked for macular degeneration. And this is a very Significant question. Dr. Bob, what causes me not to process B12? Well, there's a product that we use in a condition called MTHFR. It's a genetic issue with methylation. And we started using it in our practice just this past year. So if you have an issue with B12, MTHFR, it's a product that we use. We've had great success. Having a CBC with a differential helps us help you. Tremendous questions. Obviously, once again, you're going to want to listen to this many times. There's some really good information. I'm Dr. Bob DeMaria.